Welcome everyone to tonight's webinar. So, as mentioned, my name is Maria. I'm a clinical psychologist, and I guess my kind of speciality is working in or across physical health conditions. So, supporting people to live well with whatever physical condition they're facing. So, I'm really pleased to be with you tonight for this webinar. So, let's make a start. So this is what we're going to be covering in this evening's webinar. So we're going to start by thinking about, I guess, the uncertainty that a diagnosis and treatment brings and thinking about navigating that. So specifically thinking about the threat that feels quite present in aplastic anemia and I guess understandably a lot of uncertainty that comes with the condition. And then I guess we're going to explore that in a little bit of detail, think about the threat system, how that works for us as human beings, how that impacts on us. And then we're going to have a think about, I guess, how self-compassion can fit into this space as well, and how this can be a really kind of supportive friend for us when we're living with a physical health condition such as aplastic anemia. And then I guess the remainder of the webinar is around finding ways to navigate and live well with aplastic anemia. So we're going to be thinking about ways to regain a sense of control. We're going to be thinking about adapting to a changing sense of self, knowing that this can impact on how we view ourselves and our identity. And thinking about how values can be a really helpful tool for us as well, thinking about values as our compass. So I'll talk to you a little bit more about that this evening. And then also kind of moving into thinking about how do we live in the present? Because we know that the human mind is quite complex. It often pushes us into the future or into the past. And actually thinking about how do we bring ourselves back and connect with that present moment experience despite what's present for us in that moment. And as part of that, we're going to touch on mindfulness and we're going to touch on grounding. So we are going to finish the session with a nice mindful breathing practice, just to give you a feel of what kind of living in the present using mindfulness can feel like. And then I'll give you some other suggestions of ways that you could practice mindfulness as well. So hopefully that feels nice and accessible for you. And then if we've got some time at the end, we will of course answer any questions that you've got. So if you do have anything along the way, please pop them in the chat box and then we can come back to them at the end, but also we can reach out to everybody and see if there's any questions at that point as well. Okay. So let's think about this idea of uncertainty. So uncertainty is this kind of, I guess, by definition, the state of being uncertain. So something that you cannot be sure about, or a situation that makes you not be or not feel certain. So you'll see there that I've popped up a picture of a roller coaster, which looks quite terrifying, to be honest, with lots of kind of loop-de-loops and, you know, all kinds of different paths to navigate there along the way. And the reason I've popped this up is because a lot of people I've spoke to in my career have kind of shared with me that living with a physical health condition, and I know a lot of people I've spoken to in the groups that I run here through the Aplastic Anemia Trust have described it in this way. So it's very much like being in that theme park, seeing that roller coaster that you walk past and say, never in a million years would you get me on that. And all of a sudden, you know, you find yourself strapped into that roller coaster and it's your worst fear, you know, and it's not what you expected, but you find yourself in that space. And before you know it, it's projected you off at speed. And a lot of people talk about what, I guess, how this can kind of mirror their experience of a condition such as aplastic anemia, where actually this could start at the first point of kind of investigations. You know, it happens very quickly. We're going for lots of appointments. It feels quite scary. It's quite uncertain. There might be a lot of waiting about for results and having some kind of understanding of what's happening to us. And then we have a diagnosis and, you know, everything that comes with that. Again, it can feel very quick, very overwhelming, and a lot of uncertainty along the way. As we then move into treatment, We're waiting for appointments, we're waiting for blood tests, we're waiting to see what the results look after treatment. And there's a lot of uncertainty that we have to sit with. I know for some people at the end of this, they may be able to get off that roller coaster where the treatment has been effective, they're in remission, they get off and they look back and they say, oh my goodness, like that's what I just went through. And that's incredibly overwhelming. And I think often people find that maybe at that point, a lot of emotions hit them. And actually, that's where they maybe start to process things, the trauma of what they've been through, potentially. And that makes a lot of sense because when you're on that ride, when you're on that coaster, you're just doing what you need to do to get by. You're living appointment to appointment, you're trying to stay focused, your life almost becomes punctuated by that in a way. And I know for some people that roller coaster will continue, and it's not always about getting off, and actually, it's that constant living with uncertainty. And I guess a lot of kind of threat and fear that can come with that as well. So I guess if we think about this in a little bit more detail, there's those things which are actual threats in life. Okay, so a saber-toothed tiger coming into our space is a threat to our survival, and understandably, that will activate our inbuilt fight or flight system or the stress response. And in response to that trigger, we will experience particular thoughts, body sensations, emotions, and behaviors. And all of them are driving us towards survival. So, how can I keep safe? How can I navigate this in the best, most effective, quickest way possible to eradicate, remove, get away from that threat and be safe again? So, understandably, that makes a lot of sense in response to them actual threats. I guess the modern world is a lot more complex than when we only had to kind of navigate saber-toothed tigers. There's a lot of things now that as adults we're generally kind of faced with. There's a lot of uncertainty in life, but particularly if you're living with a physical health condition, there's an awful lot of uncertainty that you're having to kind of sit with and navigate along the way. And our mind doesn't, differentiate between, okay, this is a saber-toothed tiger and this is maybe a thought about the future, about my blood results. It doesn't differentiate. It will act in the same way. It's all about, let's better be safe than sorry than take a risk here. So in the same way that that saber-toothed tiger can activate our threat system, so can uncertainty. So human beings do not like uncertainty. We like to be in control. We like to feel that something is predictable. We can anticipate things, we can plan for that. But a lot of the time with AA, we are left with a lot of uncertainty. And therefore, it's really understandable that you might find yourself experiencing some quite difficult emotions, some really uncomfortable bodily sensations, maybe particular thoughts that might feel like, worry thoughts, fear, overwhelm, or maybe we're reflecting on the past and we're ruminating, and that's really understandable. We're trying to make sense of what's happening to us, or we're trying to predict the future so that we can plan for that and feel prepared. But a lot of the time, that's really difficult to do. So, what we know is that when we're in fight or flight, despite what that trigger has been, whether it's been the saber-toothed tiger or a particular emotion or a thought that we've experienced that's maybe triggered that fight or flight system, our body will kick into gear and respond in the exact same way as it would if it thinks we're in a survival situation. So a lot of these different things can play out for us when we're in fight or flight. One of which is our thoughts might race, and that's really helping us to try to evaluate that threat quite quickly, make quick decisions, focus on basically the danger. We need to stay on that so we can, almost predict and anticipate and plan and work around that to stay safe. So our thoughts will be working very quickly. And sometimes you do hear people saying, I just feel so overwhelmed or so consumed by my thoughts. And they might maybe be in a particular direction. So maybe it's them future thoughts, them worry thoughts of the what if that feels to be kind of having that almost domino effect. Or it might be other things, like some people talk about a shortness of breath. Again, this is a survival response. This is, in them threat situations where there's a trigger, in front of us. This is about getting more oxygen into our body so that we're more effective, we're more efficient, we can run away, we can get to safety quicker. And there's an awful lot of things that happen here in our bodies, which can feel very uncomfortable when we're experiencing that in the moment. And sometimes we think, gosh, why do I feel this? Where has this come from? And we try and make sense of that. And I guess sometimes these things in themselves can lead to more kind of uncertainty. Is this connected to my condition? Is this something else going on? Do I need to worry about this? But actually, it's all of this here is a really normal response to that fight or flight system being activated due to that actual threat or that uncertainty that you might be experiencing in that moment. So as mentioned earlier, our threat system, it doesn't take chances. It's like an alarm that sounds off when it thinks or perceives any kind of danger. And again, uncertainty will, turn on this system in the exact same way. We really do need this system. It's meant that the human race has been able to survive for, millennia. Thank you. It's helped us out immensely here. But I think sadly in this modern day world, there's a lot more things that turn on this fight or flight system now, and that can feel incredibly overwhelming at times. So we really do have quite tricky human brains, okay? And this is not our fault. We didn't ask for this brain. We were given this as a product of evolution. And I guess there's kind of the three different brain systems there that we're really thinking about. So I guess going back to our kind of basics, our primitive days, we're really thinking about, our brain very much being focused on survival and reproduction. Then we have the mammalian brain, which is all about our emotions, empathy and that kind of parental instinct. And then we've got the kind of more evolved human brain, which is very much that kind of abstract thought, that logic, and very much, you might see this kind of written down somewhere in the literature, but this is kind of our neocortex and it is activated. It's kind of the thinking part of the brain, the one that's there in the background doing lots of the kind of chitter chatter. And I guess as a result of the brain evolving in this way, it's very, very complex and it's very, very sophisticated. So it can do lots of quite incredible things. Um, but at the same time, it can sadly cause us quite a lot of problems. So what it is now very capable of is thinking about our own experiences and kind of maybe reflecting on that, trying to make sense of that. It's very good at monitoring of a situation or an inner experience and also making judgments about what it thinks is happening. Criticizing, we're all kind of, I'm sure, quite familiar with that as human beings. Often we tend to turn that criticism inwards, and it might be things like, I've not done a good enough job, or maybe this is my fault, are often things that I hear from people that I work with. And that's a really, really difficult one, I think, to kind of sit with when we recognize that we're, maybe berating ourselves in some way or beating ourselves up for something. But this is what the human brain does. It thinks it's trying to help us by doing these things. And it can also worry about and imagine the future, and specifically that kind of prediction of what could go wrong. And again, it's trying to help us out. It's trying to think, right, if we can prepare for this, we know what to expect, we can feel in control. But a lot of the time, it really kind of does go to that worst case scenario. And actually, we might find that that's quite unhelpful for us. And actually, for our emotional well-being, that's quite a difficult space to be in. We can also be quite frightened by our feelings. And an example there is kind of having anxiety about anxiety. And again, I think that can tie back into the body responses. And actually, when our body is maybe feeling anxious, it experiences that in a physiological way. But then we can maybe start to worry about what that means. But also, if we're maybe finding that we're quite anxious, we can start to worry about that as well. So it's very, very complex. And also, it's very capable of ruminating. So it can go back, it can think over situations, it can kind of try and make sense of what's happened in the past. But often, again, what we find is that we don't always kind of find the answer to that. And we can find ourselves stuck in that ruminative cycle. And actually, that can significantly impact on our mood as well. And a big one is making comparisons. So, this again goes back to kind of our primitive days and actually the times where we really did need to survive in groups of people to stay safe, to survive. And therefore, it was kind of important that we were doing that monitoring and that judging to say, have I got the skills and qualities to be a good enough member for this group? Because there was always that risk that if not, you may be kind of kicked out of that group. And actually, what would that mean for our survival? So, making comparisons has actually served us really well as human beings. But I think in this modern day world, again, this is really difficult. And actually, our groups are much bigger in this day and age, and therefore that kind of ability to compare and contrast our experiences with other people can often lead to an awful lot of distress. And I think recognizing this in a physical health context, this might play out as, I've got the same condition as, Sharon, but why is she coping so well and I'm finding this so hard? Is there something wrong with me or am I not doing something correctly? And then we can kind of fall back into that judging or that criticizing of ourselves. So it's a really, really complex brain that we're living with. It's very, very tricky. It's trying to help us, but it does cause us an awful lot of problems, sadly. And remember, this is not your fault. You didn't ask for this brain. We just have this brain and we're trying to navigate it in the best way possible. Um, but you can imagine how a lot of this stuff can make life quite difficult. Um, so, what do we do knowing all of that? And I think the first thing I really wanted to share with you today was this idea of self-compassion. Um, self-compassion is now a very kind of well-researched concept. And what it really means is there's kind of three parts to self-compassion. So the first part is this idea of, giving ourselves kindness. So turning that kindness inwards that we may afford to other people so easily. So treating ourselves with that same care and kindness as we would for maybe the people we care about. The second part of this is this idea of this shared human experience. So again, coming back to that idea of the tricky brain, we've all got a tricky brain, and it actually makes living as a human being quite difficult at times. And this is very much that shared experience. So it's recognizing that, we're not alone in this experience. We're not alone in these challenges that human brain presents for us. And actually thinking about that as that whole rather than in isolation is part of this idea of kind of self-compassion. And then finally, mindfulness. So that's the third element to self-compassion. And this is really very much about the idea of this present moment experience. Where do we find ourselves where we're at now? And being able to recognize that whole experience. So not just the positives, but what else is there for us? Are there some other kind of difficult feelings or emotions or sensations that we're experiencing right now, or some tricky thoughts? And what else can we kind of notice in that moment as well? So it's being open to the whole experience and being quite curious about that. Very much with this idea of, we do want to acknowledge that suffering. I think it's really important that we do recognize that initially and say, I'm feeling really anxious right now. And that's understandable because, so we don't need to kind of think about that in any other way than how that presents and just connecting with that in the moment. So those three things together kind of bring the concept of self-compassion. And what we know is that this is a real source of strength and resilience for us if we're able to kind of foster this or lean into self-compassion for ourselves. I do know that for a lot of us, this is really difficult to do. And there may be past experiences in our life that have meant that actually it's been quite hard to treat ourselves with kindness. Maybe we're not sure how to do that. Or maybe there's been experiences in the past where, of care that we've received that has felt quite difficult and quite unsettling, maybe quite scary at times. And therefore, the idea of being able to give care for ourselves can feel quite challenging as well. But what we do know is self-compassion is something that we can foster and we can grow and we can practice doing for ourselves. So I've linked a website there, selfcompassion.org, which is a website by Kristen Neff. So she is a big name in self-compassion. She's doing a lot of research in self-compassion. She's published books on that. And her website is really lovely if you want to check that out. So there's a really lovely section on there around kind of fostering self-compassion and some activities that you can do and skill building along this idea. So something to have a look at if you're interested. Okay, so let's think then about the next, I guess, topic for this evening, which is regaining a sense of control. And I think the reason I've kind of suggested this as something for us to think about this evening is that I guess the idea with the roller coaster, we know a lot of the time actually living with aplastic anemia can bring a lot of uncertainty, and often we can feel quite out of control, particularly when we're maybe in a period of waiting for results, or a lot of kind of not knowing. So thinking about, okay, are the parts of our lives where we can take back some control and feel that we, I guess, have some autonomy over particular parts of our life that are going to help us to experience those positive emotions, to feel like we're achieving, to feel like we're doing something meaningful for ourselves. So there's some kind of suggested areas here where we may be able to lean into, and one of which is pleasant activity. So thinking about what makes you happy, where do you get that positive hit of, emotion? What makes you feel good? What do you enjoy? And I think we do have to recognize that there may be some things that you might not be able to do in the same way anymore. So I know for some people I've spoken to recently in some of the groups that I've ran, they very much talked about being quite a social person. And actually, after treatment, they've had to really kind of protect themselves and be quite careful. And maybe they've not been able to socialize in the same way. So I guess this is a moment to just reflect on what is it for you that really gives you that positive boost? And if you can't do it in the way that you maybe did it before, is there a way that you can still connect with that now, but maybe in a slightly different way to just adapt to the current situation? So, for example, if you couldn't go for that coffee with a friend at a coffee shop, could you FaceTime that person? Could you both make sure you've got a brew, you've got a biscuit, and you have that chat, but virtually? And again, it's about the value underpinning that activity rather than the activity itself. So even if it looks a little bit different, you'll still be kind of getting that positive hit of emotion and connecting with the value behind that or the meaning behind that activity. So something to think about. Um, I guess the other one is kind of taking care of your body in the ways that you feel that you can, the ways that feel maybe important to you. So for some people, this might be about some kind of movement of their body, not necessarily exercise as we may kind of see it, because I know for different people that means different things, but somehow it might be about moving your body in some way to stay active. Equally, this could be around kind of diet and nutrition. So thinking about, what are you putting in your body? What do you want to be putting in your body? What's going to be helpful for you? And cooking some nice kind of meals or doing something that feels meaningful in that way to take care of your body whilst other things are happening, maybe alongside this with the condition. What can you do to take back some control in that area as well? And then obviously self-care. This is probably the first thing to go when we feel overwhelmed. I think it's one of them things that we almost feel like, I think for on the most part, we tend to put to the bottom of the priority list, but this is an invite to you to kind of really prioritize that. We do know that, we need some self-care sometimes. We can't pour from an empty cup, as cliche as that sounds, and we do need to kind of refuel and kind of reinvest in ourselves. And again, for different people, this will mean different things. It might be going for that long soak in the bath. It might be putting your feet up on the couch and drinking a cup of tea. It might be connecting with somebody else, and that's an act of self-care for you. So, really thinking about what that looks like for you and what you feel you need. But I guess prioritizing that as well where you can amongst the other things that are happening in your life at that time. I know I've often suggested to people, and I do this myself absolutely, because I recognize self-care is often the first thing to go. Um, Schedule it in almost as if you're scheduling that in like a bit of an appointment with yourself. So, and it doesn't have to be a huge grand gesture to yourself, but 10 minutes of, sitting and just being, or going for that soak in the bath. But I think somehow when we write it down in some way and we maybe pop it in our diary, it almost feels like we're more likely to do that if we've protected that time for it. So again, something to think about, and think about, what does self-care mean for you, and what do you feel you need at the moment. Another way that we can take back control is communicating our needs. And I think this can extend out in different ways. This might be communicating our needs with our healthcare team. This could be communicating our needs with loved ones and friends and family. Um, I think a big one here is the idea of kind of maybe changing limits and changes in functioning, meaning that others maybe have a particular expectation of us, but we might not be feeling that we can give that in the way that they're expecting. So, how do we let somebody know, and how do we kind of assertively communicate what we can and can't do? Okay. And some of that might be about putting boundaries in place. Boundaries are healthy, they're really good. They're also very a compassionate thing to do for yourself and for others. So, thinking about, are the particular things that you do need to communicate that will help you to feel back in control again? And then seeking information. So sometimes when we feel that we're sitting with an awful lot of overwhelm or uncertainty, we might find that our head is very much kind of asking questions or almost kind of seeking that additional information. And a lot of the time, we can feel incredibly anxious when we don't have the answer to a question. So if you need to go away and, do some research about your condition, that might be something that you need to think about. But my recommendation would always be, watch out for Dr. Google, watch out for kind of, I guess, the biased information that we can get through those kind of search engines. And also, we're not quite sure of the quality of that information sometimes. So, it might be seeking information via the helpline through the AAT, or it might be going to your medical team. And I'd always, encourage people to write down any questions that you have and get them answered in that contact with that person, because often that can then help us to feel in control again when we have information and we know what's happening. And sometimes it is you ask a question and the answer is, I don't know. But sometimes that can be enough for people to kind of say, right, okay, well, currently we're still awaiting that. And in a way, you've had that answer. It might not be kind of a clear, yes, we know this or we know that. But sometimes just asking that question, and if the answer is, I don't know, can sometimes feel enough to just help us feel back in control again. And then I think a huge one is connection. We know it can feel incredibly isolating living with aplastic anemia. You might have a wealth of people around you, all incredibly supportive, but sometimes you can still feel really isolated in that experience. And I think that's really normal. And absolutely across my work in physical health with different conditions, this is a theme that comes through. So, thinking about again this idea of control, how do we connect with people with maybe similar lived experience or kind of shared themes within that experience? How do we, connect with others that understand? And that can sometimes be really helpful for, again, that kind of sense of common humanity. That connection is so important to us as human beings. We really do need that, but almost feeling heard and validated as well in that experience. So reaching out to them peer spaces can be really helpful, as can just connecting with our loved ones and friends. We really need that too. Human beings need that connection. So if you found that maybe, you feel quite isolated in whatever way that is, how can you kind of reach out and connect with someone in your life again? And what does that look like? Who does that need to be? But all of these things, I think, in quite an unpredictable landscape, can help us to kind of find that sense of control again. And sometimes that can help us when, I guess, the other parts of our life feel quite overwhelming. Okay. So let's have a think now about this idea of this adapting change of self and this idea of who am I now? Because we know that I guess things can change and how we view ourselves within our spaces, within our world can look quite different when you've been affected by a health condition such as aplastic anemia. So there's a quote here from a research study in 2023 that says, I used to be a pillar of support at home, but now I am not. Now I am a patient. And I think that really highlights this kind of changing sense of self, this kind of shift in identity of how that person perceives themselves within that family unit and how the condition has kind of pushed them into that patient role, which might be a more kind of dependent role that they now find themselves in, when previously actually they were the person that maybe were doing quite a lot for other people or just were functioning quite independently and now maybe they need a bit of extra support. And we know that this is not, an easy adjustment at all. There's a lot of loss there. So it might be things like a change in functioning. Maybe you can't do some things that you did before because the fatigue is so overwhelming that you've had to adapt your daily activity in accordance with your energy levels and your mental capacity. And that can feel really, really difficult to adjust to. Maybe it is that loss of role. So, kind of, you might have been the person at home that did all the household jobs, you were quite active, you did the shopping, and suddenly now that's not possible anymore, or you need help to do that now. And it might be maybe losing a sense of purpose. So, for some people, they've had to come away from work, and that could have been a huge part of their life, a huge reason that helped them to get up in the morning and get out of bed, and actually was a big part of their identity and actually feeling like maybe if you can't do things before in the same way that you did before, or you can't do things maybe now, there might be that loss of purpose. And we know that that can connect with some really difficult thoughts and feelings. And generally, just thinking about your identity, there might be a big part of your identity that you feel has changed now, and maybe that feels like a loss. And I think what we really need to, I guess, name and acknowledge here is that this is a grieving process, and when we grieve, we experience a range of emotions. And I think a lot of the time we try and maybe push them away. We try and think, I've got to be positive, I should be coping, I should be getting up and doing what I can. But we know that this stuff is there and we know that there's loss there. And therefore, there will be these grief, you know, phases or stages or emotions that we experience. And some of this is things like shock and denial. Maybe we haven't been able to kind of make sense of that yet. We haven't been able to kind of adapt to what's happened. And maybe we're still trying to do a lot of the things that we did before and finding that we're maybe finding that quite difficult. Equally, we might be feeling quite angry. And I think that's a really, really normal emotional response to loss and change, which we do try and shut down, I think, a lot of the time. I think we somehow feel that if we are experiencing anger, we're an angry person or we're aggressive. But actually, I would argue we do need to make some space for that feeling to help us process that kind of journey that we're currently on. And obviously, things like sadness, we're going to feel, sad and maybe quite low at times, even depressed, if we found that we've been, maybe kind of ruminating on the past for quite a long time. Whatever that is that's feeding into that again, that's a really, really normal response. And we might get to a point where we feel like we can make room for some of these feelings. And I guess that's what we're talking about when we talk about acceptance. We don't have to kind of roll over and say, right, wonderful, I accept this. But actually, how do we accept the discomfort that them changes bring? So I really do invite you to, if you notice any of these feelings, firstly acknowledge that this is a really normal response to what you're experiencing here, which is change and loss, and actually just be able to kind of give yourself a bit of space to sit with that. And I think that's where self-compassion can come in really nicely, because it's that idea of I'm acknowledging that distress and I understand why I'm experiencing that as well. So I think along the line of kind of sense of self and identity, values can be a really helpful tool in our toolbox to help us think about, who am I now? You know, what's important to me in life? So values and then goals, they're quite different things. I think the way I see values, or the way I describe values, is very much like this idea of a compass. So, like north, east, south, west, it's almost like the direction that we're moving in life. So, we might have a value of compassion, for example. That's a quality, that's something that we want to kind of possess. It's something we want to show up in the world with. We might want to be compassionate to ourselves or to other people. So that's a value, that's something meaningful for us, how we want to kind of show up in the world. And like with a compass, we can head in the direction of compassion, but it's not necessarily something that we tick off and then say, right, I've achieved compassion. What am I thinking about now? However, there will be goals within that. So, for example, within the value of compassion, we may have a goal of self-care. And on one particular day, we might say, okay, for self-care today, I'm going to go for a nice mindful walk just around my local area. And that's one thing that's really going to help me to feel quite present and look after myself, just kind of notice my thoughts. And actually, it's good for my body. So I'm seeing that as an act of self-care. And when we've completed that goal, we can tick that off. So we've achieved that. So we have values, which is, I guess, this ongoing direction that we're choosing to move in. And within that, we'll have goals. So values can be really helpful for us when we feel a particular emotion. Often we can link that back to a value. So it might be we're experiencing a really positive emotion because we feel really connected with a particular value. However, if we notice that we're experiencing maybe a more difficult or uncomfortable emotion, such as anxiety or anger, it might be that something is really important to you right now, but somehow that doesn't feel accessible, or we don't feel aligned with that value. So it can give us a lot of really rich information about what's important to us, what matters to us in life. But also, if we're feeling that we've maybe been pulled off course a little bit, if we're finding that, we've been maybe struggling for a little while with a particular emotion or a particular lack of motivation or whatever that might be, values can help us find that path again. And setting ourselves those small, achievable goals within them values can really help us to kind of keep moving on that meaningful path and navigate the challenges that come along the way as well. So I'd probably argue that in pursuit of our values, that's quite a difficult path to take, because generally what that brings up is a lot of uncomfortable emotion, maybe thoughts saying, don't do this, you're not going to be able to, give up now, or actually some quite difficult emotions like maybe anxiety. When we take that meaningful path, it can sometimes feel quite scary. And I think if we put this in the context of physical health or aplastic anemia quite specifically, it might be kind of maybe coming off medication, starting to feel less nauseous, feeling that we've got a bit more energy, and maybe moving back into a space that we've not been in for quite a long time. So it might be connection is your value, and you do want to meet that friend, down on that park bench and have a coffee together, but you've not been out socially in a really long time. So, in pursuit of that connection, we might find that when we're walking there, we're experiencing a lot of anxiety or experiencing thoughts saying, I shouldn't have come out, I shouldn't have done this. But if we can think about why we're doing that, values can really help us to make a bit of room for that discomfort and still move towards what matters. So, what I would invite you to do is to really take some time to have a think about what matters to you now. So, if we can kind of take that snapshot of today, sitting there and thinking, how do I want to show up in the world? What type of person do I want to be? If my friend or loved one was to describe me now, what would I like to hear? So what would they be saying about me? And these questions, I guess, these points of reflection can really help us to get to grips with those values. So what's important to us now? And what I'd say is when you're doing that reflection for yourself, be aware of maybe external factors or influences that play into the way we answer them questions. So, for example, sometimes we might find that we think of a particular thing that feels really important to us, and we're like, I'm clear on that. But then we think about maybe the influence of a mother or a loved one or a friend or a colleague, and we might think, oh gosh, they wouldn't expect that of me. So maybe I shouldn't be thinking about this. So I just want you to notice them influences and really come to the here and now for you. And if you were in a room and no one else could hear what you're saying, what would you write down on that bit of paper as to what your values are? And that's how I would invite you to approach this values kind of reflection. So there might be lots of values that you come up with. What I'd say to you is think about maybe your top one or two and what's most important to me today. So that's not to say the other ones are not, but today, which one feels the most important to me? And is there a goal I can set myself within that value to connect and realign with that today? And make that goal as small as you need to make it. Even if it feels that it's too small, that it almost feels silly, I would argue they're the best goals to have because they're nice and achievable. They feel that, okay, we can do this. It's also meaningful. And once we've ticked that off, we're going to get a really positive emotional response. We're probably going to feel quite good about ourselves, and that will give us motivation to move on to the next goal. So make sure them goals are nice and tangible and small enough as they need to be to realign yourself with what's important to you on that day. But this can also really help us to think about who am I now and actually how have things changed and making room for any discomfort that also brings. Okay. Okay, so let's think now about living in the present. So I do think, reflecting on your values is kind of a big part of this as well. Um, but what I just want you to notice for a moment is which thought bubble is you right now, okay? Or has been you today. And you don't have to answer this question, but just to take that moment to notice maybe what's been there for you. Is your mind full of lots of things? Or actually, have we been mindful today and we've been able to focus and kind of on that one thing that feels quite important to us? So, just to kind of reflect on that for yourselves, I definitely know which one mine has been, which is sadly the one that feels quite full. But I think if that's you as well, just to normalize that this is part of being human. It's actually quite difficult to be in that other space, and it can take a lot of practice to be able to just kind of focus in on that one thing. Often our mind is very, very busy and it's doing lots of thinking all at the same time. So, what you might have noticed maybe at that point of reflection is that your body's quite present here in this space, but your mind may have been somewhere else, okay? And I think this is often the case for us as human beings. What tends to happen is our mind will often be in the past, maybe thinking about something that's happened, you know, almost trying to make sense of an experience potentially, ruminating potentially. And actually, what we know is if we get caught in that kind of past ruminative thinking for some time, it can start to influence our emotions and our sensations and our feelings and our body. And sometimes we might recognize that our mind is in the past quite a lot, and we've found that that's maybe quite unhelpful for ourselves and how we're feeling. Similarly, what you might notice is that your mind maybe spends a lot of time in the future. So, worrying, anticipating, planning. And again, sometimes this is quite helpful for us. It's quite a healthy space to be in. But if you recognize that you get caught in that space and actually that's leading to a lot of worry, it can feel really difficult on either ends of that spectrum to feel present. But what we know is there's a lot of evidence to suggest that being able to kind of refocus and be in that present moment can be really good for our mental well-being. But I think what's really normal is if you live with a health condition such as AA, what you might recognize is that your mind is in either of them poles quite often, okay? And that's normal. That's the threat system doing its job. But what we recognize is over time that can feel quite challenging and maybe quite a difficult space to be in. So mindfulness is something that we can, I guess, utilize to help us refocus on that present moment experience. So pulling us back to the here and now and just noticing what's there for us. Okay. So I guess by definition, mindfulness is about paying attention on purpose in the present moment and being non-judgmental about whatever we notice in that moment. Okay. So if it's a difficult thought, if it's a difficult feeling, whatever that might be, we just observe that curiously and we don't berate or judge ourselves for having that experience. Okay. So it's very much that kind of purposeful focus of attention. And there's an awful lot of evidence to suggest that mindfulness is actually great for psychological mental well-being, but it is quite a difficult skill to master. So it is something very different than what our human brain is used to. So it's a little bit like having to train that attention muscle in your brain over time to get good at being able to be more kind of mindful and do that refocusing of attention. Okay. So, what I thought might be helpful is just to give you an experience of what mindful breathing, so that's just one way of doing mindfulness, what that can feel like. Okay. So, let's just have a moment. If you want to take part in this, you're very, very welcome to. What I'd say is if it makes you feel more comfortable, you're very welcome to just turn your camera off, close your eyes, and just listen to my voice, and I'll just guide you through the script. Okay. Okay, so when you're ready, I just want you to start by settling into a comfortable position. Might be seated, it might be lay down. You might have your legs crossed, whatever feels comfortable for you. And just allow your eyes to close if they haven't already. Or if you prefer, you can keep them open and just soften and lower your gaze. And we're just going to begin now by taking several long, slow, deep breaths. Inhaling fully through your nose and exhaling fully through your mouth. So just take a minute just to take some nice, long, slow, deep breaths for yourself. And as you do so, I just want you to bring your full attention to noticing each in-breath as it enters your nostrils, as it travels down to your lungs and causes your belly to expand. And then noticing each out-breath as your belly contracts and the air moves up through the lungs back through your mouth. And inviting your full attention to flow with your breath. And as you breathe, just begin to let go of noises around you. Don't try to control your breath in any way. Just allow it to follow its natural rhythm. If your mind wanders to thoughts, maybe it's future planning or worrying, simply observe the types of thoughts that are trying to distract you right now or grab your attention. Or maybe just notice your mind wandering. And just watch the thought as it enters your awareness as neutrally as you possibly can. And then I want you to imagine that you're almost picking that thought up and you're going to place it on a leaf in a stream. And it's just going to sit on that leaf, and we're just going to observe as that thought just moves down the stream as we just let go of that thought and just allow it to move at its own pace. Then practice coming back to the breath with your full attention again. Bringing your awareness to the gentle rise of your stomach on the in-breath and the relaxing, letting go on the out-breath. Allow yourself to be completely with your breath as it flows in and out. You might become distracted by maybe pain or discomfort in the body, or even a twitching or itching sensations that draw your attention away from the breath. Maybe you're noticing feelings that are arising, perhaps sadness or happiness, maybe even frustration or boredom or contentment. And just simply notice where your mind goes without judging it, pushing it away, clinging to it, or maybe wishing it were different. And then just refocus your mind and guide your attention back to your breath again. Breathing in and breathing out. Just following that air all the way in and all the way out. And if your mind wanders away from the breath, just notice that. We don't have to judge ourselves for that happening. It's really normal for that to happen for us as human beings. But just notice with curiosity where that attention has gone. It might be to a thought, an emotion, or a sensation. So just noticing that and then gently guiding your awareness back to your breathing. And as this practice comes to an end, just slowly allowing your attention to expand and notice your entire body now and the overall sensation of your whole body. Being curious about whether it feels any different to at the start of this practice. And if not, that doesn't matter. We're just noticing at this moment. And then I invite you to just expand that awareness again. So to beyond your body now, to the room you're in. Just noticing any sounds that you can hear, anything that you might be able to feel, could be the temperature of the room, just being curious. And then when you're ready, you can open your eyes and come back to the space fully alert and awake. Okay. So that is just an example of a mindful breathing practice. So again, thinking about I guess the concept of mindfulness, what we did there was very much paying attention on purpose to our breathing, and then just being curious and just noticing if our mind wandered, where it wandered to, and then refocusing again on the breath. So we're not judging ourselves for our mind going off. That's exactly what the human mind will do, and it will probably do that multiple times when you're trying to engage in a practice of this nature. Or if you're trying to focus your attention on one thing, typically our mind will wander. That's really normal and to be expected. But if you recognize that your mind is wandering a lot to those maybe unhelpful spaces that are impacting on your, emotional well-being, that are affecting your behavior in unhelpful ways, this practice can be really helpful for just coming back to the present again. So there's loads of examples of how you can engage in mindfulness through like guided scripts like that online. There's some great apps. So if you're new to mindfulness, Headspace can be a really nice starting space. You can get that on Android, on Apple phones. Really lovely, accessible app with kind of guided practices to get you kind of engaged in mindfulness and what that feels like. Similarly, we can do mindfulness just really informally day to day. So say you're out having that walk, maybe you're walking the dog, maybe you're just going, for a nice stroll around the park with a coffee. You might notice that, like that picture earlier, your head's quite full, it's quite busy, it's doing lots of things. So that's a really lovely opportunity for us to practice mindfulness, to say, okay, what am I noticing right now? Where is my attention? What's it thinking about? And then maybe using something in your environment that you can see, you can hear, even feel or taste, smell, for example, could be a really helpful way of being that anchor point. So, like the breath was in that practice, one of those senses might be something that you choose to refocus on. And each time your mind wanders, which it will, just noticing that and refocusing again. So, you can do that with eating. You could do that if you were showering. You could do that if your hands were in the washing up bowl. So, it's all just about noticing what's happening for you in that moment and refocusing that attention on the activity that you're doing in that moment, using your senses as a nice anchor to pull you back into that. There's also some great kind of guided practices on YouTube. You don't even have to watch the animation. You can just pop them on, sit back and listen to that person guiding you through a script. And of course, we've got mindfulness courses, and I'm pretty sure, Sam, that we do have some offer through the charity as well. So that's something to kind of look out for if you think, I really want to learn a bit more about this and practice this skill. Um, so that's mindfulness. Obviously a drop in the ocean, and there's so much more to kind of learn about that, but hopefully a nice starting place for you if you found that helpful. And then finally, just thinking about if you do feel really overwhelmed at any point by, the condition or the impact of that condition on your life, you may be recognizing that you're caught in worry, or you're feeling quite frightened, or you're feeling really low and you feel quite stuck. Grounding can be really helpful to quickly pull you back into that present and reconnect with what's there in your here and now. So there might be that thought, there might be that worry, but what else is there for you to experience in that moment as well? So the 5, 4, 3, 2, 1 grounding technique, and I have to show my hand at this point, is a nice way to remember. So 5 things that you can see, 4 things that you can touch, 3 that you can hear, 2 that you can smell, and 1 that you can taste. So this can be a very, very quick way of just grounding yourself. If you feel swept away by them emotions or them thoughts, or if you're just feeling quite overwhelmed, it's a really lovely one to kind of have in your toolbox. So hopefully that feels nice and accessible. We can do that wherever we are. We've always got our senses to tap into, and even if one of your senses maybe isn't, working in a particular way, there's lots of other ones that we can draw on there. So again, tap into the bits of that feel most helpful for you, and you'll find which one quickly helps you to come back to the present as well, the more we practice. Okay. So that brings us to the end. Just really wanted to mention that we know this is really difficult. There's a lot of uncertainty, but in terms of this idea of living well, I think coming back to that idea of, seeking information, getting support, connecting with peers, there's a lot of stuff that AAT has on offer. So keep an eye on the events page for like the coffee mornings in your local area where you can connect with others. You can speak to people like Sam. Have a look on the events page. There's often lots of webinars and group work. So there might be things like the Managing Stress and Uncertainty course, the Moving Forward, so living life, I guess after treatment, that course as well, things to look out for. There's the monthly online chat groups that you can get involved in, again, kind of with peers and get that peer connection, or the Facebook support group. And obviously, if you do need to chat to anybody, you can call the helpline or you can email the support email there, 9 to 5, Monday to Friday. So just know that if you do need, someone to speak to or that extra support, that there's lots on offer there through the charity as well that you can connect with. So thank you very much for being here this evening, for listening, for your participation. Really, really appreciate it. I do hope it's been helpful. And if you've of course got any questions, please, I know we've only got a minute or two, if that, but if there is anything, I'm happy to answer any questions, or if there was anything that, comes to mind afterwards, I'm happy for Sam to send that on to me and I can answer anything.